So welcome again to the Health Equity Network webinar on the application of a local authority research model for reducing health inequalities by investing in partnership and public involvement. And as ever, we do record the webinar, and then Jamaica will edit and we'll have it up on the website for the Health Equity Network, and well, probably this afternoon or maybe tomorrow. Also, the slides that Sarah and Sasha will be using will be made available through that network posting as well. And Sasha, oh, sorry, Jamaica, do you want to introduce yourself and then we'll get underway?
Hi everyone, I'm Jamaica and I'm the Health Equity Network Coordinator.
Brilliant. Okay, so I'm going to hand over to Sarah and Sasha. As I've already introduced, Sarah is the business partner for the Health Determinants Research Collaboration. Sasha is the Public Engagement Management lead. And over to yourself, Sarah, to kick off.
Great, thank you very much, Alan. And hi everyone, thanks for joining us, whether it be in your lunch break. Thanks so much for taking the time to come along and hear what we've got to say. So I'm just going to share my screen, and while that's taking a minute to load, Sasha and I will just introduce ourselves and explain a bit about how we got to where we are and what our current jobs are. So my name is Sarah McNeil. I started off my sort of health career in nursing. I studied nursing to begin with, and then I went into community development, and that brought me into studying a PhD looking at access to healthcare for women experiencing homelessness in Northern Ireland, and that was kind of my big PhD piece of work. I then went on to look at housing insecurity and rurality in rural Scotland, and then after that I've now come down to this role where I'm, as Alan said, the business partner for the Health Determinants Research Collaboration in Leicestershire, and our collaboration now is basically looking at those wider social determinants that affect our health. So I'm going to ask Sasha to introduce herself as well, and then we'll get going with our presentation. Go ahead, Sasha.
Hi everybody, thanks for having us. So my name's Sasha. I started my career as a social worker in the looked after children sector and also dabbled a bit in adult mental health. Following that role, I then transitioned over to manage a community outreach team that went into communities to reduce antisocial behaviour levels in communities. And then I transitioned from that role to public engagement and consultation. So all consultations that were happening in Leicestershire, I managed, I oversaw, I made sure that they were lawful, meaningful, inclusive, all of that jazz. So that was a role for a while. And then I transitioned over to the Health Determinants Research Collaboration. We'll call it throughout the slides HDRC, because as you can see, it's a mouthful. And my role is an even bigger mouthful, so I won't subject you to that, but I am the Public Engagement Manager and I oversee all public engagement within the HDRC.
Fab, thanks, Sasha. So as you can all see on the slide, our kind of focus for this presentation is really around collaboration, and we're going to talk you through the application of our NIHR local authority model, and that's aim is to reduce health inequalities, but we're going to focus in on the kind of partnership and collaboration and public involvement that we do within that and the kind of key learning from that. So our email addresses are on the screen. Feel free to pop questions in the chat throughout, but also afterwards if you want to get in touch with us, please do, and we'd love to hear from you. So our kind of aims for today, we've split into three. So we're going to do learning about one way in which local authorities are getting involved in academic research. And I've noticed in some of the introductions, there's quite a few people from local authorities. So some of you may have other ideas of how other places have done this too. We're also then going to move on to look at understanding the importance of involving and engaging lots of different types of stakeholders and partners in all stages of the research cycle. And then we've got an opportunity at the end to hear from some of our public contributors about their experience of research involvement. So to start off with, one way in which local authorities are getting involved in academic research. So as you can see from the back of my screen and also what we've mentioned so far, we are here from the Health Determinants Research Collaboration Leicestershire, and we're going to call it HDRC going forward. So there's 30 HDRCs across the UK, and I've included the map here from the NIHR website, just because I know people on the call will be from all over parts of the UK, so you can maybe look and see if there's ones that are near you. Generally, we as organisations and as projects love collaboration, so do reach out to anyone near you if you want to kind of get involved. I'm sure they'll all love me saying that. I've circled us on the map, so you can see we're number 14. and that's kind of us in the middle of the Midlands. There's 3 of us in the Midlands. That's kind of, there's a bit of a band of nothing else going on around there, but we're the 3 in the Midlands. And so there's, you know, there's a good mix of these across the UK. So what are HDRCs? As I've said, there's 30 of us across the UK. We've all received funding from the National Institute of Health and Care Research. So we've all received £5 million over 5 years. We've received that at different times, so we're all kind of different years old, if you will, but all of our aims are the same. So we're all based in local authorities, and we're all there to boost research capacity and capability, and we're there to embed a culture of always using evidence when making decisions, specifically those decisions that will in the future impact health, and our HDRC language for that is referring to those as wider determinants of health. And then finally also that aim of including the people who we want to use research, including them at the start of the research process. So that's really what all the HDRCs are doing across the UK. So when I say wider determinants of health, you've probably heard phrases like it. You definitely have heard social determinants of health. I'm probably preaching to the choir. And you maybe have seen the Dahlgren and Whitehead model of the kind of rainbow model of the different factors that influence individual health. We actually created this poster on the screen with our public advisory group that we work with in our team, just to kind of give a different visual representation of what we mean by those wider things that impact health. And these are just some examples that we worked with our public to kind of explain what we mean by those wider things that influence health. But it's basically, as you all probably know, the causes of poor health or good health. And that's really what we're interested in and what we focus in as HDRCs. So more specifically looking at Leicestershire, so as I mentioned, all of the HDRCs have 5 years of funding from NIHR, but Leicestershire HDRC got 1 year of additional funding at the start that was called a development year, and that was really just to get us ready for the full 5 years of funding. So that was our full year of 2024. It was really doing recruitment, getting governance things in place, and getting a lot of stuff ready for that kind of full funding and the responsibility that comes with full funding. And so we started our full funding process in January this year, 2025. So we're now 10 months into year 1, and I would say we're doing pretty well. I think we like to think that we've got good progress, but we've still got sort of 4 years to go, and there's lots of work to be done to kind of influence culture change in local authorities, as I'm sure many of you know. In terms of where we're based, our team within Leicestershire County Council, we're based within the Business Intelligence Department, which is basically like a data and insights department that serves, or data insights team that serves the different departments of the council. So there's people within the business intelligence who work with the kind of adults and communities department, with the children and families department, with the environment and transport department. So that business intelligence team has arms that reach in and across the rest of the council. So that's why we're based in there, to kind of make that easy for us to then also link into those other departments. We do work very closely with public health, as you can imagine, and our 2 co-directors of our HDRC are actually the Director of Public Health and the Assistant Chief Exec of the council. So that's kind of a little bit about our structural governance. In terms of our team, we've got 5 full-time staff. Sasha and I are 2 of those. I've tried to count. I think we have 7 part-time staff, but it's like a day here, half a day there, all sorts of other bits and pieces here and there. So I could be wrong about that exact number. But we've basically got other people from across the council, from public health, from project management teams, from comms, from the business intelligence service, who all kind of feed into to our team as well. And then on top of that, we've got 3 academic staff who give us either half a day or a full day per week from some of our partner universities. And you can see our partner universities on the screen. So we're partnered with these 4 universities, and we've got collaboration agreements with them, and we've got time from some staff from those universities to contribute to our project. And that's kind of a little bit of what our Leicestershire HDRC looks like. In terms of the actual what goes on in Leicestershire HDRC, this slide shows our HDRC roadmap across the 5 years, but also into the kind of future and into the long term. So in our kind of long term aim goals, we've got things like reducing health inequalities overall, having a real culture of evidence-based decision making, and kind of just having continuous investment in research within Leicestershire County Council. Obviously, we're not going to do that in year 1, but that's our kind of end goal. So our kind of years 1 to 2, years 2 to 3 and onwards are more about getting those kind of building blocks in place so that that kind of culture change and reducing health inequalities can happen in the long run. So really, development year and year 1 has been about establishing collaborations, partnerships, getting the right people around the table, getting involved with getting our public involved, getting the right voices around the table, and doing a little bit of kind of, okay, what are the research needs, what are the research priorities that we have in Leicestershire, and then what are our kind of next steps for those. So that is my whistle-stop tour of what is HDRC Leicestershire. Please do feel free to ask questions at the end, but now we're going to move on to kind of point 2 of sort of understanding the importance of involving and engaging different stakeholders in the research cycle. So yeah, sorry that first bit maybe felt a bit like a whistle stop. I was saying to Sasha earlier, the HDRC to us is just our day in, day out. Like, we just kind of do the same stuff every day, but it's actually quite a complex model to try and explain. So I hope that was clear, and do please ask questions. So in terms of engaging and involving stakeholders and partners, I'm sure many of you have seen different models and different images of the research cycle, the research process. This is my personal favourite. It was made by a public contributor in an NIHR funded team, I think in 2022, but I could be wrong about that year. The reference is there at the bottom, but this particular research process was made to show where patients, carers and the public can be involved within the research process. So that's what this kind of diagram shows, is there's your kind of 8 stages of research process, but on the outside in the black writing you can see the bits where all the different opportunities for other people to get involved and for public to get involved. And I've actually got this as my background in my laptop just to remind me that there's so many places in the research cycle that other people can get involved and other partners can get involved. It's not just at the start, it's not just at the end, it's not kind of a tick box. It's actually throughout the whole cycle. And although this cycle in particular is looking at patients, carers and the public, we in the HDRC are also interested in including local authority staff and including voluntary and community sector, and getting various academic partners involved at different stages. So it's kind of almost a broader look again at who our partners are and then where they get involved in the cycle. So that brings me on to sort of who are our partners and how do we actually get them involved and what's our experience of that. So Sasha and I have picked out 3 key stakeholders, the public, the local authority staff and the academics, and we're going to talk through sort of strategies for how we work with them, and then kind of some success stories of what's gone well maybe. So I'm going to hand over to Sasha now to talk about our strategies for engaging with the public, because she's our public and community engagement manager.
Thanks, Sarah, and thank you, everybody. So we've worked really hard to ensure that our public voice has been embedded in Leicestershire HDRC, and we continue to strengthen our commitment to meaningful public engagement, involvement and participation. There are a range of ways in which public has helped to shape our HDRC, and each public contributor brings a distinct perspective grounded in lived experiences, personal experiences. So as Sarah's just illustrated the research cycle, I wanted to bring you guys back to that. We have a public co-applicant. She sits on every stage of the research cycle. She is there to embed meaningful public engagement and ways to work with the public. She is our critical friend in relation to decision making. She sits on our board meetings, our team meetings. She is fully embedded within our HDRC and within the HDRC, the research cycle as well. So that's just one of the ways in which we ensure public voice is paramount and is always heard. I also recruited a public advisory group. This group comprises of 8 community members. They have a diverse background. They provide a lay perspective and sense checking of processes and documents and communication issues and accessibility. They offer a constructive challenge to our staff members, to our HDRCs alone, and they're involved in multiple task and finish groups. So they also are embedded within the research cycle, sometimes from the beginning, sometimes a bit further in, but public voice is always embedded throughout everything that we do. Another thing that we've done, we've recruited our community research champions. And these are our community representatives that will be doing the deeper dive in our community and sharing with us the issues that communities are facing. They will provide evidence-based data to help us identify gaps in research where we need to do more. So our community research champions are the eyes and ears of our community, and that's another way in which we get public voice. And rather than working from a top-down approach, we work from a bottom-up, and we find out what's going on locally, what's currently happening, and what is impacting on our local community. We also have a public member on our oversight committee. And that's working really well. And they have that public steer, that public hat on. So we are always on track in terms of involving our public, embedding the public voice and hearing what's actually going on and what we need to be focusing on in terms of our HDRC initiatives. Also, in terms of our reach, we have engaged with our aftercare council. So our aftercare council is made up of care leavers, and they have been paramount in helping us in developing our documents and making sure that they are public friendly and youth friendly, and our language is lay friendly, and all of them things. So our aftercare counsellors played an active role in helping us with documents and the dissemination of our information. I also go out and do outreach work in our communities. So I've accessed a couple of community groups. Some of them are older groups, and I'm trying to embed myself in underserved groups, so groups that our HDRC really want to hear from. So I'm out there doing our community reach, and that's going really well as well. And also later on in the year, I will be visiting prisons to get prisoner voice and prisoner thoughts on health inequalities that they experience in prison and upon leaving prison. And that's all going to form part of our public and community strategy for our HDRC. So some successes, we've had quite a few successes, but these ones on the screen are the ones that really stood out for me. So we're talking about culture change. And we have started to see a shift in our culture change in terms of when we bring public voice in and what we do with that voice and how we feed back to the public of what we've done. So you said we did kind of thing. So that culture shift has started to happen, and it's taken a long while. We're still nowhere near that full culture change, but we have started to see a shift, which I'm really happy about. We've collaborated with different departments across the council. So I've linked in with the local area coordinators, the aftercare council that I've just mentioned, the communities team, so and the voluntary sector as well. So I've got my fingers in a lot of pies in terms of working with others and really understanding what's going on and how they work and how our work can be merged together, and how we can help each other out basically. Our public advisory group, so our PAG, has been embedded in most of our pillars. So we've got 6 pillars for our HDRC, and our public voice has been embedded throughout most of them pillars. And like I said before, they're involved in various task and finish groups, not just for our public and community pillar, but in pillars such as research governance and knowledge mobilisation. So we've and communication. So we've always got a voice, a public opinion, a public check and challenge in all that we do. We have delivered successful training with our public advisory group in areas of research, equality, diversity and inclusion, wider determinants of health, and what public involvement means basically, because it's part and parcel of my role, but for others coming in, what does that actually look like in practice? What do you want from me? So all of that training has been undertaken. And one of our biggest successes is earlier on this year, we hosted a public assembly where we invited 75 residents to come in and help us set our research priorities for this year. That was a huge success. People came, people really voiced their opinion. We got some beautiful, rich insights as to what's currently happening and how this is impacting on them and their health and the health inequalities that they are currently facing. Alongside the public assembly, we went into 3 schools and we delivered 3 youth engagements on the same topic. So we asked our young people, what does an ideal community look like to you? What's getting in the way of that ideal? And that also helped set our research priorities. So together with our public voice and our youth voice, we amalgamated that data, and then we have set our research priorities, and that couldn't have been done without the input from our public. In designing that public assembly, we had public involvement, we had youth involvement, so it was a real big project with a lot of voice and a lot of input from everybody to make it as rich and as powerful as it was. And the successes on the screen, again, the community groups and our prison visits. So prisoners are a really underheard cohort of people. So I thought, you know what, let's just send an email, see what the crack is. And then we got accepted by the Ministry of Justice. And now, as I said, we've got a visit coming up later this year. So I'm really excited to see what insights we can get from our prisoners, from our people that are maybe facing the most health inequalities, and the community groups. Honestly, I love going out in the communities. I love just chatting with the people. And I love just hearing what's going on and how we can make a difference. And they love to talk to me, and that information sharing, but more so for me, that knowledge exchange that we provide when that happens when I'm in these community groups, it's gold dust. So overall, together, we've built a solid foundation for our public community involvement, engagement and participation, one where there's shared learning and equal footing, so there's no power imbalances. I try not to have no power imbalances. We are all equal. We've built an environment that allows our public contributors to participate fully and have their input valued. They've co-produced our public advisory group and our youth groups and everything else that I've mentioned. We've co-produced welcome packs. They have co-produced terms of reference. We are currently co-producing our public community involvement, engagement and participation strategy. So all of this rich insight that I'm gathering and that we already have in our team with our public co-applicant and our public advisory group and our community research champions, it all is building a bigger picture, and it's making us more informed on how we should be approaching our health inequalities in Leicestershire.
Thanks, Sasha. It's you can all clearly see there's plenty going on in terms of our public engagement. So I'm just going to quickly look through sort of how we are engaging with our local authority staff and then also our academics. So in terms of our local authority staff, I've got some kind of strategies under in bullet points and then some successes in the little bubbles beside. So some of the strategies we've got in terms of engaging our local authority staff have been an annual staff conference that so far has had really positive attendance, and it's had attendance from across departments, which is really great. And that's an opportunity for staff to come and present research posters of things they've been involved in. We get academics to come in and do presenting some kind of learning and equipping and upskilling our staff in research and kind of research literacy almost. And so we've actually got our staff conference this year in 2 weeks, so it's all getting quite busy for our team at the moment to kind of come together and organise that. Then we've also got our staff training series that runs throughout the year, and that's basically just to increase staff research understanding through again our academics run that training, and from that you can see in the white bubble on the side, and we've actually had some of our social work within the council set up their own journal clubs, and that was after some training on how to read a research paper. We then suggested, one good way of increasing your skills in reading research papers are journal clubs, and we've then supported I think it's 16 people now who've joined 3 different journal clubs and are reading and critically reading research papers, which they wouldn't have been doing without attending that training. So that's been really amazing to see that kind of impact already. We as an HDRC attend quite a lot of senior leadership meetings, departmental management teams, you name it, really just to increase the visibility of what the HDRC is and what we do, to get that senior buy-in, so that then that can be cascaded down into other parts of the council. We do quite a lot of promotion of the NIHR Academy opportunities. So there's opportunities within that kind of Research Career Development Academy at the NIHR for local authority staff specifically. So we just do a really good job of promoting that as wherever we can, and support people with writing applications, and kind of link them in with someone who's maybe already done the placement so they can see a bit what it's like, and really just promoting those opportunities that are out there, but just encouraging people to apply. And then finally, we're launching this initiative called the Ask HDRC. Shout out to Fuse, based north of England. They were a great help in kind of driving us to start this Ask HDRC process. And we've basically based our model completely on what they do. So what Fuse do is they're I don't know the exact geography, but I believe they serve 13 local authorities in the north of England. And they have a service called Ask Fuse, where local authority staff can submit requests for, I've got knowledge gap here, an evidence gap, I need some research done on this topic. And then the Fuse team will work with that local authority member to write that up into a bit of a research brief. And then the Fuse member of staff will go and connect with academics and bring the research brief and say, can you help? Can you connect? Is this something you're interested in? And then they will almost do like a matchmaking service where they bring together the academic and the local authority member of staff to kind of address that research or evidence need that the local authority has. So we're running the same model. We're going to be doing that starting in a few weeks. We're launching it at our conference, but we've actually already had some staff that for us. We've got 2 research projects that have come out of trying that model, or 2 research projects that we're currently writing up bids based on the needs that local authority staff have. So that's been a really positive model as well to use for local authority staff. Then in terms of our academic kind of engagement, often we kind of have our strategies to engage with academics, but we're also finding that academics do sometimes come to us, and that's maybe the sort of normal model where academics maybe reach out and say, I'm doing this research project, it might benefit you, do you want to be involved? But as Sasha said, we as an HDRC are almost trying to do bottom up instead of that top down approach, but we still do get some of that top down approach, and where it matches with our research priorities, we're very happy to have that input. But other kind of strategies we've got for engaging with academics include we've got co-applicants from the 4 different partner universities that I mentioned who were on the original bid. So they kind of help us link in with research, things that are happening at the university, introduce us to researchers that are kind of doing what we're doing. So we've got a wide variety of co-applicants, but there are co-applicants from all 4 of those 4 universities. We've got match-funded PhDs with 2 of the universities, so there's 4 PhDs funded in total that our HDRC and our partner universities are funding, all based on wider determinants of health. So that's another way to engage academics when there's kind of a bit of money on a project involved. Again, the staff conference, we invite academics along to that. As I mentioned before, we've got academic staff on our board. And then finally, there's the kind of Ask HDRC function allows academic staff to have almost a job to do whenever we reach out. If we reach out and say, can you help with this? And then that kind of starts the relationship, and that may lead to a research bid, it may lead to some other kind of collaboration, but that Ask HDRC thing is quite a good sort of initial reach out to academics. So those are just some of the examples of how we engage with our partners and kind of how they've gone. We now are on to the 3rd one, where we're going to hear from the public about their experience of research involvement. So over to Sasha again to explain the next few slides. Go ahead, Sasha.
Thanks. So this slide is a vlog, and David is one of our public advisory group members. We're not going to play this slide today, but you will get the copy of the slide, so feel free to watch that on our YouTube channel. But yeah, it's a good watch, and it is he's just basically saying why he thinks public involvement is important and why it should be done. So yeah, have a gander at that one when you've got time. Next slide, please. And this slide is from Cecily, our public co-applicant. She, as mentioned, she's been involved in every stage of the research priority, the research cycle, and she was also involved in planning and designing and implementing our public assembly. Now, we did at the beginning, we did call it a citizens assembly, but from feedback from our public and from our public advisory group, the word citizen was causing a bit of confusion. So we changed citizens assembly to public assembly because it was more personable. People understood it better. But this is why it says, how are you involved in the citizens assembly? It is the same event. So over to you to press play. So sorry, Sarah's computer's crashed, and I didn't know we didn't know how long it was going to continue. She is trying to get back on, but if we haven't got time to finish that video, then please do watch that video. It is really insightful. It's really profound, and how Cecily articulates her involvement in the public assembly. So these are just some quotes from our participants from the public assembly. I thought that would be just a nice addition to hear what the public had to say, being involved. It was a full day event. If you've got any questions, wider questions on how I recruited and planning and some, please email me, because it's not as quick and as simple as it was a long process, put it that way. So if you do have any questions on that, I'm happy to have a separate call with anybody if you wanted to find out more information on that. Is it going to go to the next one? Oh gosh, I hate technology. Right. And so just to wrap up, these are our key learnings for this session. So some of the challenges that we faced were the expectations and different priorities, the competing priorities of all the people that we work with, the different departments, the public, the academics. So managing expectations and then trying to embed that into a timeline that was suitable for all, that was a massive challenge. Shared language was also a challenge in terms of where I came from in social work. LAC meant looked after children. When I transitioned over to the chief executive departments, LACs were local area coordinators. So different meanings for different languages. And again, the young people that I work with hate the word, that they hate the title Health Determinants Research Collaboration. They hate the wider, there's so many words that are not really accessible to our public. So that's something that we're continually working on. We've produced a glossary of terms so people can understand what we're meaning when we say a certain word. So the facilitators of our journey so far is building trusting relationships, getting in with the early involvement and early engagement, rather than thinking, oh, sugar, I need to involve public in this, or I need to involve X in this. We always plan it out, who needs to be involved at what point, at what time, and we give everybody enough ample time to, you know, understand, absorb, and get involved. So that early involvement is just paramount, really. And planning and communication again goes hand in hand with the early involvement, but knowing who you need and when you need them and planning that effectively and robustly, honestly, it will save you mountains of stress. I learned the hard way. All the grey hairs are evidence of the stress endured. So please don't do what I do, and just plan effectively from the minute you've got your project to, you know, to your end date. And then that's just thank you from us. And there's the links to our HDRC, our LinkedIn, our website. And if you've got any further questions, like I said, you can always email me, because our emails are at the beginning of the slide deck.
Brilliant.
And that's
a fantastic presentation, Sasha, and Sarah as well. Hopefully Sarah can get back in. And a phenomenal amount of work that's been done in 10 months. That is brilliant. Really good to hear. I'm going to move quickly on the questions.
Yes.
We probably won't get through all of them. And if you have had your question answered, then just let me know on the chat, and we'll skip on to another question, because some questions were asked early on in the presentation. But first question was Tiberius Pereira, and everybody, please do correct me if I've not pronounced your name right. But Tiberius, are you able to come on and ask your question? It was about main responsibilities.
Oh, yes, thank you.
Yeah,
and
go ahead.
You've pronounced it perfectly, Ashley. Thank you very much. Yeah, the question is really, you know, I'm in Ireland and we're at a much earlier stage, you know, so this has been really encouraging to hear, you know, what you've done and, you know, how much progress you've made. I think that the challenge we have really is mainly that, you know, it's hard to get someone with lived experience who can represent themselves, and at the same time having you know, true patient, you know, the true voice of every patient, of being representative of every patient. So, you know, from, you know, we're patient representatives as well, and I can only represent myself and my experience and those close to me. I can't pretend to represent, in particular, someone from a someone who's much more vulnerable, maybe who's been living in poverty or experiencing homelessness, you know, or serious mental health issues. Those people tend not to have the confidence or the time actually to join, and so that's something that we're really struggling with. You know, so how do you make sure? You know, what were the kind of secrets to your success, I suppose?
So I think Sarah's back, so jump in when you want to, Sarah. But in my experience, to access them the groups that are underheard, seldom get involved in, you know, initiatives such as this, we will go through the services. So we go through the services where they can give us an insight, and then okay, for instance, Gypsy Traveller communities. We had a Gypsy Traveller representative on our public assembly, and how I got that person to come was to go through a trusted person, a trusted organisation that she's currently engaged with. Then we had a conversation. I explained what the day was going to look like. It wasn't going to be formal, you know, just put her mind at rest. And she came, and I'm continually speaking with this lady, and she gives me a really great insight on her experiences as a Gypsy woman. So going through trusted people, trusted organisations, going to where people are as well is really important. They potentially wouldn't come to you. So that's why I've got my feet on the ground, and I'm trying to get into every community group and make friends and all the rest of it. But it's about being vulnerable yourself. It's about kind of lowering your barriers and coming from an empathetic route, and just really genuinely wanting to understand what they're going through and how this can align to your work and what you can do to help them. And if you can't help them, can you signpost them? So it's working with your connections, knowing what's within your area so you can signpost if need be, but also going through them gatekeepers is how I've kind of got through to some of the underheard, seldom involved groups. I hope that helps.
Thanks, Tiberius, for the question. Thanks, Sasha. Rich Browning.
Hi, thanks for the informative slides. So I work on a CIC in Manchester and work with local authorities, but also another role I have is Manchester BRC, and we're looking at the translational research aspect of what a biomedical research centre does. So really what this what is. So the difference that inclusive research makes to people's lives. And having sit in both spheres, both the BRC and local authority work, I often think that evidence that so what sits within local authorities and vice versa, that some of the impacts you'll be looking at will sit within BRC's the evidence sphere. So I suppose I'm just interested in knowing how you'll work with your BRC. If you are planning to.
I'm to answer that, Sasha. First of all, sorry everyone that my laptop has completely died and I'm on my phone, so I hope this is okay. But in terms of our BRC, Rich, we've actually we applied for some funding from our BRC earlier this year to do those youth engagement workshops that Sasha mentioned during her slides. So we have already got somewhat of a relationship with our BRC, and through our universities, they've already got lots of these kind of partnerships in place. And I think you're right that often, you know, some of the research that we do or some of the work that we do, the impact and the implementation sits with someone else, and vice versa, as you say. So I think we've got strategies in place and partnership, which is what today we're talking about. Having those partnerships and strategies and relationships in place in advance means that whenever we have a finding that we can say, oh, by the way, we think this could be implemented in your zone, what do you think? Because we've already got a bit of a trusting relationship, we've already done a bit of work with them. It might mean that there's a more welcome reception for that sort of those recommendations that might come. What I would say is we've got one of our 6 pillars that we sort of, our work streams sort of within our HDRC. One of those 6 pillars is knowledge mobilization, and it's really thinking about, okay, we've got knowledge, what do we do with it? What's next? What's the kind of how do we maximize the impact that knowledge can have? How do we make sure knowledge is used and mobilized and doesn't just sit there? And a lot of that is around these questions. So we are linked in with our BRC, but more generally, that kind of knowledge mobilization strategy is being thought about.
Yeah. So that knowledge. Sorry,
Rich. We're going to have to move on. We've got so many questions that we can't really come back on. But thank you very much for that one. Can you just say what does BRC stand for? Maybe I'm the only one that doesn't know.
Biomedical Research Centre.
Thank you. Neil Bendel. Hi, Neil. You there still?
Yeah, hi. So I'm Neil Bendel. I'm a public health specialist in Department of Public Health, Manchester City Council. I'm also one of the co-applicants in HDRC Manchester. I put a number of questions in the chat, but the one I wanted to kind of ask about was around culture change, and specifically what your thinking is in relation to how you measure culture change and whether it's improving or not. Specifically in terms of that aspect of culture change that links to evidence-informed policy making. It's something that I'm looking at the moment as part of a pre-doctoral fellowship, and you may have seen through the HDRC evaluation subgroup, we're currently undertaking a piece of research with the University of Manchester colleagues and talking to HDRCs about that specific topic. So very happy to talk to you about that as well. But yes, it's about the measurement of culture change, basically.
Yeah, and I'm happy, Neil, to have a wider conversation about this after when we have more time. But our main answer for that is we do have an external evaluation partner who's partnering with us across the 5 years, and they're basically an evaluator who they've got all sorts of KPIs and deep dive topics and things that they're watching us do over the 5 years, and they're picking out indicators to sort of prove different parts of that. And one of the things that she's going to be looking at is our culture change. And I was actually having a conversation this morning with one of our co-directors about sort of culture change in the long run. What does that look like? And some of the kind of almost little stories are some of the things that we think could work. So for example, I know lots of local authorities do needs assessments, so whether it be health needs assessments, joint strategic needs assessments. One of our ideas as an HDRC is to have a research needs output as part of that needs assessment. So if that is done, if we can say, okay, we used to do JSNAs like this and now we do them like this, and look at, you know, X% now does this, and now the local authority can prove their research need in each of these strategic areas, we think that's a good sort of indicator of culture change. But there's going to be lots of sort of stories like that rather than kind of culture score 1, culture change score 2, and we think it'll be more kind of years.
Thanks, Sarah. Just remind people if you could go on mute whenever, if you're not asking a question. How'd you finish there, Sarah? Yeah, thank you very much. And thanks, Neil, for the question. Nafis Faizi, would you like to come on? And again, correct me if I'm not pronouncing your name right.
Oh, Nafis is perfectly fine.
Brilliant.
I just wanted to know, Sasha, or Sarah, how did you identify these people? Were these people already having a relationship with your council and you identified, or was there an invite out, and how did you select them?
When you say people, are you talking about the people that attended our public assembly, the people that I'm currently engaged with?
The advisory groups, especially.
Oh, the public advisory group. We went out to advert, we put an expression of interest out there, they answered some questions, we got a really good turnout, and then I kind of just had an informal conversation with them. But it is a bit of a longer process than that, so please feel free to email me and I will be able to send you that and my processes for the stratify sample that I did for the public assembly and just how I engage on a normal day-to-day. So it is a bigger conversation and I'm happy to have it, but I know we're pushed for time, so please email me. Thank you.
Brilliant, and yes, do follow that up, Nafis. That sounds very interesting. Thanks, Sasha. Catherine Meads. Are you here, Catherine?
Yes, I'm here. Yes, my question is, there's a lot of effort going into what you're doing, but is it actually improving people's health? Because the reason why I'm asking that is a lot of work around finding out what health inequalities there are, but much less about what to do about it. And it's what to do about it is not that known very well in local areas. So, in particular for particular minority groups. And my other question was, have you done any research in the LGBT group? And in particular, have you done anything around, say, how to address the higher rates of smoking within the LGBT community, or anything to do with poor eating in the Gypsy Roma traveller community, or it's the how to address the health inequalities is the key part now, rather than finding out who has which health inequalities.
So you can come in as well, sorry, Sarah. So when I do go out to our community groups and that are the questions. How can I help you? What's ideal look like to you? So I'm not trying to find out just solely what's actually going on. I want to know what's going to help. So for instance, I went to the older group, the older people's group, and they had a massive issue with transportation. So I took that back to the transport lead, shared their views, and then we did an application for funding on transport and older people. I don't know what happened with that. I don't know whether
I can jump in.
Go on.
Catherine, what I would say first of all is that we are very much still in our kind of infrastructure year, and we don't have kind of research submissions planned until year 2, which would be next year. So we definitely haven't actually conducted any research because we haven't even submitted for research money yet. But the questions that you're asking are the kind of questions that we'll be asking. It is okay, what works, and in some cases it might be an evaluation of something that's already happening. So Sasha's example there about the transport, that's what we're hoping to, we haven't put the bid in yet, but we are hoping to bit in about a service that's already in place in Leicestershire that anecdotally we've kind of heard bits and pieces about. It works here, it doesn't work here, but no knows why. So the research that we're putting a bid in for is an evaluation of that service to say, does this work? Who's it working for? You know, and a lot of the research we're going to be doing, it may not be directly obvious how, like, having a bus service going to reduce someone's blood pressure? Potentially not. But it will help them get to their Falls class, their dementia cafe, their community group. So because we're that wider determinants of health, we're almost, our outcome for a lot of our research will be things that we know would impact health, but we're doing the research about how to get to that part rather than that part into health. But the questions that you've brought up there about LGBT community, about eating with Gypsy Roma traveller communities, those are exactly the kind of questions we'll be asking. We just haven't got to that stage in our programme yet, but I know other HDRCs are doing similar type questions, so you're right on track with topics.
Right. Okay, thank you very much. Thank you.
Yeah, great question, Catherine, and thanks for the response, Sarah. James Kelly, are you there, James?
Hi, yes, thank you for the presentation. So yeah, my question really was about what were the research priorities from a public perspective when you had your public assembly, because I'm a GP and I see an awful lot of problems with regards to access for gentle rehabilitative exercise within the community, and I think that's kind of my focus about people who can't get to gyms, people who struggle to rural communities particularly, or coastal communities where I live. I think that's kind of a priority for us, and I'm looking to find out what was the priority from a public perspective.
Yeah, so I mean, I'm happy to try and recite our priorities if my memory can do it. So we identified 9 priorities from that public work, both with the public assembly and the youth engagement. So they fit under 3 umbrella themes. So the 3 umbrella themes are what's around us, who's around us, and what are our opportunities. And then within each of those 3 umbrellas, we've got 3 kind of priority themes. So within the, Sasha, you can help me out if I get this wrong, but in the what's around us, we've got safe and affordable housing, we've got spaces and places that influence health, and that's really around planning and commercial determinants of health, that one. And then the third one is that sort of green spaces and rurality and access to green spaces. Then within the who's around us, we've got isolation and sense of community, we've got knowledge sharing and empowerment, and we've got feelings of community safety. And the community safety one was a massive one that came up with our young people. That was really, really important to young people, that sort of sense of feeling safe in their communities. They felt that really impacted their health. Then in the what's the last one, where have I got to? What are our opportunities one? We've got one theme that covers all education and employment and other opportunities, which is the broadest theme we have. So it's called opportunities to live and thrive, or inclusive opportunities to thrive, pursue aspirations, I think. Yeah, that's it. Inclusive opportunities to thrive and pursue aspirations. So that's kind of a big broad theme. Then we've got income and cost of living and thriving. And then our final one is, oh my goodness, inclusive and accessible transport. So that's probably the one you were mentioning there, James, the kind of transport issues. And so under each of those priorities, we've kind of got details about what really specifically matters to our community under each of those themes. And within our inclusive and accessible transport, we had lots of issues with rurality. We had issues with accessibility of buses and the kind of sort of mobility equipment being able to get on buses, issues with kind of times and bus timetables and routes and all sorts of things like that. So our inclusive and accessible transport was a big one. More specifically for rural and disabled communities was a big it was really important for them, was that inclusive and accessible transport. So there was my little test for the day, trying to remember those now.
Well done.
Well done, Sarah, honestly.
I think we can maybe get 2 more questions in. Harvey Kennedy Pitt, you there?
I am, thank you. I was hoping to lurk in the shadows and not have to come on camera, but I am very curious. Hello everyone and good afternoon. I am very curious just about how you screen people that we're engaging with, because oftentimes you get the same faces, the same people coming through, and it ticks the boxes that you need to have. You know, you're feeling really great and confident that you've followed all PPIE sort of methodology and you can sleep well that night. But really, you've got the same sort of surface level stories, and actually there's lots of people who are lost to the entire conversation, who are in much more vulnerable situations, and those are in a position to respond. And I'm just wondering what guidance you can give to those in the group around how we can avoid doing that, because it's naturally, you know, when you're really busy or stressful, it's easier to just go with who came forward and sort of feel good that you've done your job, but just going the extra mile to make sure that we're getting the right people. How can we kind of do that?
So the recruitment process for the public assembly, I swear, Harvey, was the longest period of my life. We went again, expression of interest form, but within that form we embedded demographic details, which I strongly suggested that people completed, because I was going to use that data to form my stratified sample. So I had 5 or 6 areas that I wanted to hit. So everybody that hit that area kind of got through to the first round. Then another sample. So I went geographically then. So where were they placed geographically? So I had a widespread of Leicestershire. So I went through that stage, Then I went through the age. So literally every step of the sampling period, I went through all of the people that ticked the box and checked against it. And that's how I got a really wide range of not only demographics, geographic, ethnicities, age. I had on the public assembly, I had people from 18 to 84 all the way through. So it was a really long process. We had over 170 respondents to want to participate in the public assembly, so going through all of them with a fine-tooth comb, and then having to go through again because some people dropped out or some people didn't have the time. So it was the longest process of my life, but happy to have a bigger conversation. Obviously I haven't gone into full detail there, Harvey, but there was a method that I did follow and was able to hit what I needed to hit in terms of underserved and everything else. Sorry, Sarah.
I just add to that, Harvey, I think one of the key things that we really would advise is the financial remuneration, I can never say the word, to the public, because I think that is something that if someone's not usually involved in research, but they realise their time's being respected, their time's being valued, it might be something they'd be more likely to get involved in if it's not something they've been involved in before. And actually you raise an interesting point about how do we stop having the same people come back, and maybe Sasha and I should talk about, do we have a tick box in our form to say, have you attended one of our events before? And we try and get a percentage that haven't, you know, each time, or at least we can then monitor who's not new face. But it's a good point. I'm not sure that we've really looked at that because we haven't held enough events to have repeaters yet. But it's an interesting point you raised, so thank you for that.
Thanks, Harvey. And I'm going to squeeze in one last question. Crawford McGugan, go ahead.
Thanks, Alan. I just recap on what my question was. I think it might have been answered in terms of what Catherine was asking, but how has the community engagement work influenced your HDRC work programme? Are you now focusing on geographic areas, protected characteristics, or has it highlighted intersectional issues you weren't aware of?
Do you want me to answer, Sasha?
Yeah, you can go for that one.
I mean, I think we've kind of got the, like, whenever someone asks, so how has public involvement influenced your work? I've got the kind of key stories in my head of what's happened, so I can share those. But I think more generally, we're using the PIRIT tool. I don't know if anybody's familiar with that, but it's a tool that helps you monitor what impact that your public engagement is having on your work. And I think that's really vital, because I think a lot of the time people sort of know they're supposed to do public engagement work, but they maybe don't see the value of it. Something like the PIRIT tool forces you almost to see the value of your public engagement work. But I'll share one little example. So our public co-applicant, who we've mentioned, are a good friend of ours at this stage, Cecily, she and I ended up at a conference together kind of by accident. She was going through a different role of hers, and we ended up getting the same train home, and we sat in the train and we had a big chat about sort of our findings from the conference. And she had attended a session about young people, and she just said, we haven't engaged with young people yet with our priorities. What are we doing? We haven't done that. And from that conversation, I then went and had a conversation with an academic at a different event and said, yeah, our public applicant said we haven't done young people, you know, maybe we should do something about that. And that then led to us planning a school youth engagement. So it was a one-off conversation after a conference that because she is part of our group, she had a thought that I didn't have, and that then she brought that in, and we engaged under 18, which we wouldn't have done without her input. So that's just a example, but it's important to monitor those things, and our parrot tool is something that we're using to do that.
And just
Brilliant.
as another example, sorry, Alan, if we've got time, just as another example, one of our public advisory group members is visually impaired. So accessibility has been a massive learning curve for us in terms of what's accessible to screen readers and having the voiceover over a video so whatever's on the video is being described to her. So there's certain things where we've emailed NIHR saying, can we get a voiceover on this video because we can't edit ourselves. So I say little things, but things that are more personal within our HDRC, we are then now tracking wider and having conversations for people, like when we can't edit videos, can this be edited or can we have a different version, and so on and so forth. And in terms of our communications, it's enhanced our communications, our accessibility awareness. Even though we're trained to be aware of, accessibility issues, it just kind of becomes like, oh, it's just a run of the mill kind of thing. And it's not until somebody comes in with a visual impairment or another disability that we're thinking, oh, okay, is that? So stuff like little things like that are on the ground and more intimate to us it's making changes in that respect as well.
Brilliant.
Sorry, Ellen, we ran over.
Don't worry. Great question, Crawford, and thank you so much, Sarah and Sasha. That was a brilliant presentation that you gave us, but thank you so much for taking the questions, and it's a testament to the range of questions that we've had and that we haven't been able to get through them all, that people are interested in what you're doing. And I think everybody has heard Sasha's and Sarah's offer to follow up afterwards, and the emails are there in the first slide, also within the text there. So I'm sure you would welcome people contacting you afterwards.
Yeah.
Thank you very much. Excellent presentation, great webinar. We'll be back again in 1 month's time at the end of November with a webinar looking at pandemic AIDS report, which we launched before then. Thank you again, everybody who's attended, and particularly Sarah and Sasha.
Thank you for having us.
Thank you.
Bye.
Bye.